would like to introduce Veronika Honkasalo, who is a member of Parliament for the Left Alliance from Helsinki, and she has approached substance and drug policy issues, especially from the perspective of human rights. Welcome, Veronika.
Thank you so much, and a very happy International Women's Day to everyone. So I started my day by visiting this kind of open place in eastern Helsinki for people who have problems with mental problems and then drug use. It's a day center called Sympis in Finnish, and I was actually quite honored that I got an invitation to start my Women's Day by visiting that place, and the idea was that I would be there for about 1 hour, but I just couldn't get out from there, so I was almost 2 hours there, and it was such an important visit to talk with people, both like professionals working there, but also people who have been using drugs or are using drugs at the moment. They are doing extremely important work in the field of harm reduction, for example. But unfortunately, these kind of places, we don't have many of them in Helsinki at the moment, 3 only. And for example, where I live in northeastern Helsinki, we don't have this kind of places at all, and actually in connection with this day center they have information place, health information where you can get health care very quickly. So we surely have use for those services. But the sad thing is that the decision makers, they don't have contact with these people. They don't know the everyday life in these suburbs. So when we decide about budget and funding, these are not like a high priority, unfortunately. So I have been now for 4 years in the Parliament, and I have been the chair of the Human Rights Network in the Parliament, and that network consists of different parliamentarians from different parties, and the idea is that we are raising up questions that are linked to human rights problem both globally, but also in Finland. The idea is that Finland wants very gladly to promote itself as an example of human rights globally, but I think that we have to take care of our own human rights violations before we can promote ourselves globally. So my idea has been to kind of focus on problems in the Finnish society from a human rights perspective, and those kind of problems have been, for example, elderly care, mental services, and then the drug policy and politics as a whole. And as we know, and this was also something that they were talking in the day center today, as we know, sadly, the amount of young people dying in drugs in Finland is the highest in Europe at the moment. And we know from experts that the legislation we have at the moment doesn't work. And actually they were also talking about this in the day center today, that it makes their work really difficult when they are giving, for example, this basic health services. People who seek for help, they don't want to get registered, but the city wants everyone to be registered because that's linked to the funding that the day center can get. So, for example, when they are taking care of these very bad infections, they have to register the patient in their system. And then the professionals in the day center said that they feel that that's an obstacle, that they shouldn't do that, that like prevents people from seeking help to infections that could be taken care like really easily. So the legislation doesn't work, the system doesn't really work, so that the preventive work would be possible. So also when you look at the situation in the streets of Helsinki, you can quite easily notice that there has been a generational change among those people who don't have who have like multiple problems and who are homeless. So before, now it's like those people who were born after the economical depression in the 90s. And we can also see a generational poverty. So there are a lot of people in the day center, for example, whose parents are also visiting regularly the day center. So this is not only about that the services should be taken care of, it's a broader issue. We should take the income level of these people up, and then the housing is a very central question. There is not enough of housing for homeless people in Helsinki at the moment, and especially if you look at young people, they were talking that they don't want to go to these shelters which are meant for older people, and especially, for example, young women are facing a lot of violence, so they have to then choose the street instead. So the young homeless people in the Helsinki streets, it's a growing problem. We have been working in the parliament very much in order to make the legislation better, and one paradox that I have been talking about quite a lot is that how can it be that at the same time as the attitudes are changing in the larger society, the attitudes within the parliament, it doesn't change. So the questions or the discussions are very conservative, and they are like for control and restrictions, and then outside the parliament people want to have a change in our drug policy and the legislation, and that's a paradox that I don't know, I'm a sociologist myself, but I haven't found an answer to that. Why is it so that people tend, when they are chosen to be like parliamentarians, they want to promote a conservative politics towards drug politics rather than a liberal one. But I think that we need more like knowledge-based decision making. It has been very helpful that a lot of researchers have been active in the discussion in Finland. So you have to, like in these discussions, you have to take into consideration that there is a lot of academic research that shows that this system doesn't work at the moment. So I really hope that now when we are having elections in 3 weeks, that this question would also be like a central one, and that we would more talk about that we have to stop like criminalizing poverty, and so that there has to be a change in the next period, so that our drug politics will be based on human rights, based on the fact that even if people would never stop using drugs, even then they deserve decent living, and that they have human rights as well. So we have to take care of everyone, and I'm especially worried about the young generation living in the streets in Helsinki. So there's surely a lot of things to do, but taking into consideration the drug deaths in Finland, I cannot understand why this isn't a bigger issue for example, in the public at the moment. It should be definitely a main topic in the elections. This is a question that should be asked from every party leader, that what are you going to do so that this horrible trend will change. Thank you so much.